The concept of a food desert is still relatively new, partially due to the steady suburbanization of major food retailers. Food deserts have now become a major contributing factor to the number of people suffering from chronic illness. Although food deserts can be found in areas across the United States, the highest number of food deserts exist in the southeastern part of the country. Englewood is one of the larger neighborhoods on Chicago's South Side. Although today it is inhabited mostly by African Americans, historically, Englewood was an entirely white neighborhood. The neighborhood began to change quite drastically in the 1960s. Because of issues like gentrification, lack of funding, business relocation, and a significant drop in real estate prices, Englewood has shifted from one of the most profitable neighborhoods in Chicago to one of the most disenfranchised. Low median incomes, high unemployment rates, and a lack of proper education are partially responsible for the significant issues facing Englewood today, such as high crime, high homicide, and chronic illness. Although crime rates in Englewood have decreased in the last 5 years, it is still one of the highest crime rates in the city for violent crime, property crime, and quality of life crime. An Englewood resident is much more likely than their average Chicago counterpart to suffer from many preventable causes of death, such as assault, coronary heart disease, and diabetes. Englewood is one of many neighborhoods in Chicago that can be considered a food desert. Even with the addition of grocery stores like Aldi and Whole Foods, access to fresh food in this community is still limited. Limited access to fresh foods often means that people living in those areas are not properly nourished. Not only is there a connection between poor food and chronic illness like obesity and diabetes, it is also linked to mental health issues like anxiety, depression, ADHD, schizophrenia, and bipolar disorder. The issues in Englewood are multifaceted. However, the lack of basic nutrition for the residents could explain some of the behavior. People cannot function properly if they are eating foods that are detrimental to their health. Having access to fresh foods is a necessary part of being human. If an individual's environment does not provide basic human needs like food, money, and shelter, the odds of thriving are much more slim. In the past few years, many efforts have been made to change Englewood's environment. The top picture is of an Englewood resident who is working on a community garden, and the lower picture is of a brand new Whole Foods that opened at the end of September of 2016. While these efforts are headed in the right direction, public health officials will have to address the lack of food-related nutrition education and how current policy is reinforcing the status quo. The aforementioned efforts, combined with comprehensive awareness programs and effective policy, could completely eliminate food deserts in Chicago.